Good afternoon. For those of you that don't know me, I'm Jennifer Mars, a dietitian that's been at Passivant for the last year and a half. And a few of you mentioned that you were interested in a discussion and some information on pre-diabetes. So we're going to talk a little bit about that today, and I will have the slideshow handouts for you later and a pre-diabetic diet guide, just some small changes you can make. Okay, so what does pre-diabetes mean? First of all, how many of you know somebody with diabetes? Pretty much, I would say almost everybody. But what is pre-diabetes? So we are going to talk about today the definition of pre-diabetes versus diabetes, how it can occur, risk factors, signs and symptoms, how to reverse, and lifestyle changes. And then any questions at the end, you can come up and talk to me privately, or we can do that as a group. Okay, what is pre-diabetes? It is a higher than normal blood sugar, not high enough to be considered type 2 diabetes mellitus. Abbreviation DM, so if you see that in the handouts, that's what that means. It means you don't process sugar and glucose properly, also known as insulin resistance. Insulin resistance is when your body makes insulin, but it does not use it correctly. Instead of fueling cells, sugar builds up in the bloodstream, cells become resistant to insulin and do not allow as much sugar in. Without lifestyle changes, it will likely turn into diabetes mellitus type 2. About 25% of people with pre-diabetes, it will develop into type 2 diabetes within 5 years, unless lifestyle diet changes are made. The good news is, if those changes are made, it can be reversed and diabetes can be prevented. I don't have this in the slides, but I did want to mention, I'm not really going to discuss diabetes type 1, but that is when you have it as a child, as a juvenile, and usually that happens, people find out anywhere between very young age to their preteen years, early teens. But we're really going to try to focus on pre-diabetes and how to prevent that from turning into type 2 diabetes. So, excuse me. Okay. BG is blood glucose, and if you see BS, they're interchangeable: blood sugar, blood glucose. We're going to go over the ranges and what the A1C means. So A1C, also formally called or technically called a hemoglobin A1C. That is the more accurate, and it's a long-term indicator of your blood glucose. For example, fasting blood sugar, when you go to the doctors and they give you the blood work and they say, you need to fast for this. That is a very short-term indicator in the last day or two, in the last 24 hours. And A1C is anywhere between 60 and 90 days accurate of what your blood sugars were. That is sort of the Cadillac, the standard used. So sometimes people will say, oh, I'm eating great, I'm doing this. My fasting blood sugar was high, but I ate this yesterday and that's why. Well, the A1C you can't fool, you can't trick. It is more accurate. So what is considered less than 5.7 is within normal limits of your A1C. 5.7 to 6.4 indicates that you have pre-diabetes. For pre-diabetes, the diagnosis usually requires 2 tests of increased blood glucose to confirm it. 2 separate A1Cs, which they would do them within a second one in 60 to 90 days. For your fasting blood sugar, less than 100 is considered normal. 100 to 125 is indicative of prediabetes, and greater than 126 times 2 of those results is also indicating that you have prediabetes to diabetes. So, how does prediabetes develop and what are the risk factors? 1 in 3 Americans have prediabetes. About 80% are unaware. That's a pretty high number. Prediabetes usually has no signs or symptoms, and family history of diabetes and genetics play a key role. Also history of gestational diabetes during pregnancy or in females, polycystic ovary syndrome are also kind of pre-indicators that that can happen to you. Sleep apnea and smoking are other indicators. Other risk factors are weight, obesity, your waist size. In men, greater than 40 inches, in women, greater than 35. High cholesterol, diet of a lot of red meat, processed meats. Processed meats would be your lunch meats, bacon, sausage, things like that. Sugar beverages, not just soda, but that can be lemonade, iced tea, things like that. Inactivity, age greater than 45 years old. Race and ethnicity, higher in African American, Hispanic, American Indian, and Asian American ethnicities. Okay, signs and symptoms. Some indicators that you have prediabetes or full-blown diabetes, darkened skin area around the armpits and the groin, increased thirst, frequent urination, increased hunger, fatigue, blurred vision, numb and tingling hands or feet, frequent infections, or unintended weight loss. Typically, most people, if you're experiencing that, you are already in a lot of those symptoms, the diabetes type 2 category. And one thing I will say is you can also reverse the diabetes by these same changes. So I know somebody recently that they were really happy to say my A1C was 7.3, but the one before that, or 2 before that, it was 11. So that was a huge difference. And so they made a lot of changes and really got that down. Also, prediabetes symptoms in women, if you have frequent yeast and UTI infections, or earlier in life, or have had longer and heavier periods. When prediabetes is untreated or turns into diabetes type 2, you can get any of the following: increased blood pressure, increased cholesterol, increased risk for heart disease, stroke, kidney damage, eye damage, fatty liver, neuropathy, which can lead to amputations. Typically starting at the toes, then the feet, going up the leg if it is completely ignored and not treated. What can I do to prevent diabetes type 2 if I already have prediabetes? The good news is with lifestyle changes, you can prevent prediabetes from turning into diabetes, or as I said earlier, if it's already diabetes type 2, you can reduce that also. Things that you can do: increase your physical activity, and it doesn't have to be, lifting weights, anything crazy. Walking, just going on more frequent walks. Group exercise, there's a facility right here at your disposal. or whatever best exercises and things like that suit your lifestyle. You might not like a group setting, you might like to do the pool, anything that you can do to just a little bit increase your physical activity. That's also beneficial in many ways, but you're also going to have some weight loss, which is also part of helping diabetes. Small modifications to your diet. And the reason I say small is because when anybody gets that diagnosis, they get a little overwhelmed. Oh my gosh, I have to make all these changes. I have to buy different foods. I can't eat this, I can't eat this. And that isn't the case. I mean, really, the number one step you can do is to reduce your meal portion sizes. That is just key. You can eat more vegetables, you can eat more of your proteins, fish, chicken, turkey, things like that. But your starches, your mashed potatoes, your french fries, those types of things, you want to reduce those. At breakfast, maybe you're gonna have a half of a bagel instead of a full bagel. It makes a big difference. Increasing your vegetables, fish, seafood, some of you may have heard of the Mediterranean diet, where you're eating a lot of vegetables, a lot of fresh seafoods. That has had a lot of very successful results. However, I like to point out that there are many different diet changes, or I hate to use the word diet, but diet adaptations, they don't work for everybody, and you might not like seafood. So the Mediterranean diet might not be the best fit for you. So it is a very individualized approach in some ways, but as I said, just increasing your physical activity and reducing your meal sizes makes a huge difference. Reducing the amount of red meats, processed meats, as again, the sugary beverages, switch to water. If you like a flavor, sparkling water, the flavored pouches that you can add to water bottles instead of all the other sugary beverages. What can I do to prevent diabetes type 2? Read your labels. And I'm not going to go overly into it, but for diabetics, we say 15 grams of carbohydrates, if you look at a label, equals 1 carbohydrate choice. So what does that mean? Well, most people think it's the amount of pure sugar you're eating in your diet. Oh, I can't eat pie, I can't eat cake, I can't eat sugar. But it's really the amount of carbohydrates that you are consuming that really plays a role. So everybody is individual. It depends on your height, your weight, all kinds of different factors, which is why it's good to talk to a medical professional. But a nice little rule of thumb is about 3 to 4 carb choices at breakfast and about 5 at lunch and dinner. And what that means is 15 grams if you're shooting for 5 at dinner. So 15 times 5. So you want to have a bowl of pasta and you think, oh, I can't have bread. You can have a piece of bread, breadstick, garlic toast, but you need to eat maybe a half of that and then a smaller amount of pasta. And truly, serving sizes in labels are key. You'll be shocked if you actually start reading, even in beverages that look normal size. If you look at the serving size, it says on there 2 servings per container. So if you think you're getting 25 grams of sugar because you're going to drink that whole thing, it's 50 grams of sugar. So just being aware of the labels is also very important. Use the internet for recipes and diet tips. I wouldn't go get all of you don't want to just use it randomly on websites for your medical information, although there are some valid ones, and I have those attached at the end. But it's a great source for different recipes for what you're trying to achieve. See your registered dietitian. Some of you know me, and Maria is upstairs also. Our office is across from the clinic. They can do a custom meal plan for you, especially if you're picky or there's certain things geared towards what your amount of carb choices should be based on your height, your weight, your goals that you're trying to achieve, and the things that you like and don't like. You can always find diet guides online, but it might have oatmeal for breakfast and fish for dinner and those are not things you like. So the customizable approach does help a lot of people out. A couple of the other, intermittent fasting has been successful for some individuals. It just depends on your age, on your lifestyle, but some people have seen really good results with it. And there's a whole guide on how to do it based on your age, what you're trying to do. Some people do it from 8 p.m. to 8 a.m. for a 12-hour fast. But again, everything is very individualized. American Diabetic Association, and I have the website on here, that's another very good tool to find a lot of really good information. So what can you do? You can advocate for yourself always. In all of your medical decisions, you or somebody that is, in your family or close to you, somebody needs to be an advocate. And so if you're at the doctor's and they're going to do some routine blood work, you're there for a physical, you can say, I would like an A1C. And then, at least you have a gauge of where you're at, because again, you might not have any symptoms and it's starting to climb. You'd rather get it when it's in the, right there on the cusp or a little over than to find out, oh my gosh, it's my A1C is 10, I now have full diabetes. Make small lifestyle changes. Increase your walking, add a little bit more vegetables. Try to eat a salad before your meals, because vegetables are they're like a freebie, and vegetables, they don't count for your carbs, but the dressing does. So, okay, I'm gonna eat a bigger salad, a little bit of dressing, and that's gonna fill you up a little so you're not eating all those starches during your meal. See a registered dietitian. Custom meal plans, use the internet for recipes. Certain diets, again, work better for others. Use resources available to you here at Passivant. Fitness center, group classes, the swimming pool, all kinds of things like that. Go on walks with your friends. Okay, I'm happy to answer any specific questions. It can be after this. We don't have to do it as a group, and I can stand around and answer any specific questions you have. And I have a business card too, and Maria does also, as again, we could be reached. But I just want to say thank you. Thank you for being an advocate of your own health by being here today. And again, my name is Jennifer Mars, dietitian. I work for Lutheran Senior Life in Cura. And I included the sources of this information today from my slides. Mayo Clinic, Cleveland Clinic, WebMD, American Dietetic Association. And again, thank you for your time today. And I do have a copy of today's slides and a diet sheet that just recommends some little changes you can make to help prevent prediabetes or reduce the signs of it. Thank you so much.